thank you for joining us for today's Revenue Cycle Roundtable. I'm Lori Jeffries. I am the Revenue Cycle and Client Engagement Consultant at Revco, and I'm excited to be your host for today's discussion. Today, we're diving into one of the most critical components of the patient financial experience, call center technology. A lot of times people don't want to talk about call center technology, or they forget that it's there. But it's one of the biggest areas with patient engagement. So as expectations rise and operational environments grow more complex, the tools we give our frontline teams can make all the difference in both the patient satisfaction and staff success. I'm excited to sit down with Belinda Daniel, who is the manager over customer service and my chart at Duke University Health Systems. She has played an instrumental role in advancing call center operations across her career. She's led innovative efforts to rethink how representatives learn, how they access information, and support patients in real time. So I want to jump right in and welcome you, Belinda. It's so good to see you.
Well, thank you, Lori. I'm happy to be here. I'm happy to share about this subject.
Oh, I think it's a great subject to talk about, and I'm looking forward to all the things that you have to share with us today. So thank you. And we're just going to jump right in, okay?
Okay, let's do
So
it.
tell us about yourself. So can you tell us a little bit about your career path, what led you to this role supporting call center operations at Duke Health?
So I've always been a big proponent of patient advocacy. I've made my career out of helping patients one way or the other. I have extensive experience in front end operations. Served as a business and operations logistic manager, supervised registration hubs, launched Duke's Medicaid eligibility program, and managed the pre-auth teams for both in-house and outpatient. And so now I find myself driving efficiency while promoting kindness for all in the call center.
I think that's wonderful. You've had an amazing career, and it's been wonderful watching you. But I think the bigger gift was me having the opportunity to actually work with you directly. So you led the creation of a powerful optimization tool that provides training and what we call that 3-click resource guide for call center representatives and your leadership team. What problem were you originally trying to solve there, and what inspired the design of this solution?
Well, when I got here, when I first made my entry into the call center space, I started asking people, "What do we need? What if I could do? If I could do one thing to improve our efficiency or our patient satisfaction rates, what would that one thing be?" I think the best solutions come from the people who do it day in and day out. And the answer was really simple: create a better way to access the information that they need on a phone call, quicker, better, more thorough, more complete. And then that question became the foundation for this solution that we're going to talk about today. It empowers our team to deliver in a more timely manner. You don't want someone trying to figure things out on the phone when you call, and they're more accurate and they're more confident. And a confident representative is what we want to put out there, right? They can get to the bottom of your problem, whatever that is.
It's funny because we always want our patients to get the best care possible, and a lot of times in revenue cycle it's not talked about a lot, right? it's
Right.
it's like, yeah, you just don't talk about it, and it's like it's the number one thing. Everything in revenue cycle touches the patient, right? So
Yeah.
can you walk us through how the software works in real time, of what you were able to develop from the rep's perspective? What does it feel like to use it, like while they're live on a call with the patient, because they have to know so much, right,
Right.
across the Epic platform and across, they have no idea what the patient's going to ask when they call. So can you kind of walk us through that and tell us in real time, like, what does it look like?
Certainly. Let me give you some background of where we came from so you can really appreciate where we are at the moment. We were using Microsoft OneNote as the repository for miscellaneous job aids and staff meeting training, and it was separate than our training manual. And so we had basically pushed OneNote to the outer limits. It was so full, and so because we do have to know a lot, and we had just pushed it to its limits, so we knew we needed to find that. As far as working with the program, what you get a home screen, and that home screen has, I think, 13 or so icons that you can choose them from a topic. Say financial assistance, make a payment, take a call, do an adjustment. All of the ones that we use most often are on that one glance, third of the page um, snapshot, right? So then it has search features that you can use, a keyword, um, budget plan instead of financial assistance, mail mail solutions or contacts. We have a list of a spreadsheet with contacts or who we know who to contact. So you can use that key phrase as well. The information in the system is can be customized to what we need. So we will often matrix different pieces of our phone call. We might use the same verbiage for a financial assistance application as we would a payment plan or something like that. So it goes back and forth, so you don't have to recreate everything, but it has that matrix function. Um, it allows that, and that allows for consistent responses. So you're saying the same thing, everyone's being told the same thing. It just helps for future conversations. Um, the structure uses this philosophy of 3 clicks. So if they're looking for something, they should be able to find it within 3 clicks. And we've done that for the most part. There are a few situations that are a little deeper, but for most inquiries, we can get to what we need within three clicks. Um, from the CSA's perspective, the CSAs love it. Those that have been here for a long time who were in OneNote, they love it, especially because they're no longer using that tool. And then those that are coming in are just amazed at how thorough and complete and easy to find things that this product allows. So one of my staff members, I asked this question. One of them said, Panviva is our mini customer service encyclopedia. Um, she says that she relies on it for her step-by-step instructions on how to complete tasks or refresher on policies. Um, it that those updates are really important when you're trying to get something to your patient. Um, One of the favorite features is this feedback feature. If you're on a procedure document and you find something wrong or information has been updated, you can immediately let leadership know. Or we have a group assigned that can go in and make those ad hoc updates the same day. We used to have to wait for days for things to be updated because you had to go through a process. This puts it right back in our hands. It's dynamic. We can send notifications uh, if something happens with our telephone systems. We just immediately go in and put an alert. Everyone sees the same thing at the same time. It's one of those wonderful features about that.
So
Um,
it's actually like an intercom system, but right there on your screen.
Yeah, it's intercom, knowledge base, history, training. It's one resource. One, you
Yeah,
don't
and
have to
I
remember.
love the way, yeah, I think that's incredible. And I love the way that, when you talk about scripting and stuff, and it makes that consistency for the patient too, right? And
Yes,
understanding and the way that you wrote the scripting that can help the patient better understand what they're talking about too, right?
Exactly.
That's
Right.
incredible. It's good to hear some of the things that your staff have to say about it too. That's really
Yeah.
nice. I love that. So when you first introduced this tool, how did you approach change management? Because it's a big deal, right? Going from OneNote
Yeah.
into something that's kind of automated and real time and structured within your screen, right? It's right there on the screen. They're not having to go search for a policy and procedure or figure out what was the name of that policy. So I know how to look it up, and you've got the patient on the call. So when you first introduced it, how did you approach the change management? That's a big deal. And what steps helped your team adopt the new workflow and feel comfortable relying on the technology doing these live calls?
Yeah, we knew from the very beginning this was going to be a big thing for us, right? So outside of our conversion of computer systems, this was for the call center. This was the next largest thing we've ever undertaken. And so we brought staff in early. We asked them what they needed, what they wanted, how they wanted it format, trying to get a feel for what was the best way to set this new system up. So they were involved from the very beginning. I think that was really key to the buy-in at the end. We still had a little bit of an issue with people wanting to use what they've been using for 20 years. But we let them until they got familiar, and then we eventually sunset the OneNote, and but they got there. But I think involving the people that it's going to affect from the get-go. We used a consultant that was referred to us by the by Panviva, and they were very helpful with helping us set up the structure, kept us on task. We had spreadsheets to we basically did this from kickoff to go live, we did it in 4 months, meaning that we wrote 75% of our procedure documents. We had something to start with in 3 months, and that was huge. But the supervisors and our SMEs all came together and made that happen. So everyone had a part in it. I think that would have been, if you had asked me what the key to our success was, everyone had a piece in it, whether it was telling us, doing it, um, testing it out. We tested it out with some people.
I
Um,
love that concept because, at the end of the day, when you involve them early on in the build and then you start to roll it out, the rollout is going to be much easier, right? It's like because they're
yeah,
familiar with, because anytime you have something that big that you're changing, the language changes, how you
right.
talk about things change. And not only that, we were getting out of the paper world, right? People were so comfortable with holding on to something, a piece of paper, a policy, or whatever they could hold in their hand. But for something to be bolted right there at the bottom of your screen, almost like a cell phone window,
Right.
that's at the bottom of the screen, and it's like a home page within your home page. It's quite incredible that you bring them all together, and then the training is much easier downstream. So
Yeah, and
yeah,
so the new people get trained inside of Panviva. There is no longer a separate training manual.
that's incredible.
And yeah, and that also helps them acclimate quick and get what they need so we can get them on the floor answering calls from patients.
That's really nice. So what impact did you see after the implementation? Like either in call quality or training consistency, or did it improve the training classes, reduction in errors,
Yeah.
the overall
Yeah.
staff confidence even? Tell me more about that.
Well, the first thing that we noticed with our emphasis on new scripts and effective scripts, the first thing we noticed was our patient satisfaction jumped, I'm going to say, for me, through the roof. We were hovering somewhere in the high 80s, and we had like 95, 96% within 2 months, and that was just from this tool being deployed. that was huge for us. To gain a point in patient satisfaction is a huge deal. So the other thing that we did really quick, like, was we reduced our training time to down about 25%. So we were able to get our people on the floor quicker by having one source of truth and having it taught. So they're being taught the resource that they're going to use on the floor, as well as their initial um, um, voyage into the train customer service. And if there was a third one, we've seen an increase or a decrease in our average handle time. I know handle times vary across the gamut of call center operations. However, we felt like ours was a pretty significant drop, so we were happy with that as well. And then we keep continuing. It's easy to update, and we keep finding new and different and exciting things to keep the staff engaged with that tool also.
So with the tool technology, once you were trained on that system from an update, so you don't actually have to submit changes to an IT department or anything like that. They actually taught you how to do it as if you were updating something on your cell phone. If
Yep.
you were adding another app on your cell phone, you just go and you do it yourself. So you and your team, like you were able to delegate that to other members of the team as well, right?
Yes. And the best way to learn something is to teach it. So this is a way of teaching them and making it stronger, making them stronger as well. So
Yeah,
it's
absolutely. Well,
yeah.
it's interesting to think about after you've been in it for a while and you've been successful, and you have new hires coming in to an organization as large as Duke Health, and they see a training program that is that savvy. What do they say about that on the new side of it? What are the new people saying about it?
So the new people who have some experience in healthcare are amazed at our training program. Just simply amazed that we go to the length that we go to get them the information that they need, and that it is dynamic and can change from day to day. I keep telling them, they'll say, "Oh, I can't find this." I say, "Well, I added it yesterday. Go look." So it's that movable, it's that changeable.
That's
Um,
great.
yeah, so I think that's the key there.
So looking ahead, Belinda, what advice would you give other healthcare leaders who want to improve their call center operations or maybe adopt something similar that's an on-demand training tool? What advice would you lay out there?
Look, I would say my first thought was just do it, right? If there's a need that your people have, um listen, listen to what they need. But don't be afraid to take that first step. This was a huge undertaking for us. Um and it is worth everything. We're sharing our documents with other departments for consistency's sake. So it just doesn't help the call center, but I have FCCs and scheduling leadership reaching out to me going, well, Belinda, what do you have? We know you've got something already written down. So it's a point of bragging as well, if you will, that customer service has got it all going on, and that feels good to be able to help other departments. I hope that answered
Absolutely.
that
You know, it's
question.
that side. You and I talked a lot of years. We've talked about how the call center is kind of the silent partner that kind of sits over there, to the side. But this has really brought out an engagement across so many departments of assistance because the documentation is so streamlined, and you're able to keep up with your policies and procedures and the changes. Healthcare is changing every day. And
Every
so this
day.
allows you to really keep it up to date because the patients are calling on a whim, and you've got to be at your A game every time you're there to help the patient and try to make it as easy for them as possible. So
Yes.
this is an incredible success story. I'm thankful for you, Belinda, as you know, and I appreciate you sharing your insights and for giving us a closer look at how thoughtful technology can truly empower call center teams.
Yeah, and
At
thank you.
Revco, yeah, I mean, at Revco, we firsthand know how the right technology elevates performance, it reduces the friction for patients, and it'll give representatives the confidence to deliver the consistent, high quality support. So
Yeah,
we're always excited to partner with organizations that are ready to take that next step. And we appreciate you as one of those partners. We appreciate you, and we thank you for spending time with me today. It's always a joy to see you.
always. And well, I thank you for this opportunity. I'd love to get this out here. I think it will help a lot of people, and always open to answer questions if people have them.
I think that's wonderful, and I know health systems will appreciate it and can reach out to you. So that's just a gift. So thanks again, Belinda. You have a great day. It's good to see you.
You're welcome. Thank
All
you.
right. All right. Bye.
Bye.